Welcome to Psychology to Live By. Joining me today on this roundtable are four wonderful people from Network Music. So I welcome Terry McBride, CEO, Chris Norwood, Head of Strategy, Colin Novak, Music Manager, and Karen Mix, Director of People Operations. The podcast we're going to discuss today is called Chronic Pain and Illness, the Promise of Neuroplastic Treatment Therapy. But first, to a quick summary of the podcast. This was a fascinating conversation with Dr David Clarke as he explains neuroplastic symptom therapy. Dr Clarke's the president of the Association for the Treatment of Neuroplastic Symptoms, a non-profit dedicated to ending the chronic pain epidemic. He holds an MD from the University of Connecticut School of Medicine and is board certified in internal medicine and gastroenterology. His organisation's mission is to advance the awareness, diagnosis and treatment of stress-related and brain-generated medical conditions. His podcast is The Story Behind the Symptoms, and the website is symptomatic.me. So the backdrop to that discussion is the epidemic of chronic pain and chronic illness around the world. It's estimated that 1 in 6 adults suffers from chronic pain or illness that is either medically unexplained or unresponsive to virtually any treatment. Many of these patients have neuroplastic symptoms defined as brain-generated conditions linked to past or present stress, trauma or emotions. These chronic symptoms manifest themselves in many ways as fibromyalgia, migraines, irritable bowel syndrome, long COVID, chronic back or musculoskeletal pain, and many, many more conditions. Such symptoms respond poorly or not at all to traditional medical treatments. The experiences with conventional diagnosis and treatment leave most people with neuroplastic symptoms feeling neglected by the medical profession and hopeless about their future. So we discussed how the brain generates these symptoms and the benefits that patients derive from neuroplastic symptom therapy, which changes their brains, giving them not only symptom relief, but positively changes their lives and work. So patients learn to listen to their symptoms, often discovering unrecognised emotions, old traumas, or aversive childhood experiences that express themselves via the body. Results with this approach are astonishing and are backed by gold standard randomised controlled trials. So, all in all, it was a wonderful discussion. And that brings me to my very good friends at Network Music. How are you, my very good friends? Yeah. I'll take that. All nods all round, it smiles. So wonderful to see you again. I'm again, or as always, really curious to see how you responded to this particular podcast, what your thoughts are, what your insights are, and So let's, with no further ado, who wants to talk first?
Chris, you have to talk first. You usually talk last.
Sure. I This is an interesting conversation. And I guess what where I was trying to circle around, I understand like there's a huge opportunity for people that are suffering from these types of issues to get some treatment that otherwise maybe they've been suffering through these pains and these conditions. Other than going to see, obviously, like that's where you're going to get the benefit is by going to go through these therapy processes. Are there things that people can embed also just in their day-to-day life that might help them navigate these things? And like, or is it just we should be steering towards these sort of newer therapies in an attempt to help people improve?
Yeah, okay. So perhaps some context for the listeners here. So It seems to me there's kind of two categories embedded in the idea of neuroplastic symptoms. One category would be where a person has had an identifiable illness or damage of some sort that along the way has converted to a neuroplastic symptom. So, a good example, you've had some injury, it's measurable, the treatment is given, and let's say it's a back injury, and and the original scans indicate that there was physiological damage. Subsequent scans sort of indicate everything should be all right, right? And what the scientists have done is they've looked at the brains of people where there is very clear physiological cause, and they look at the brain areas that are responding to those damage signals from the body. Notice, by the way, that they're not pain signals. So the body doesn't send pain signals. It sends signals to the brain that's saying there's damage here. And the brain figures out how much pain should be correlated with that damage. Okay? But even so, at first, the brain centers that light up originally are very different brain centers that light up later on and sometimes for years after. So, and those latter brain areas are more typically responsible for things like emotions, memory, and meaning making. So clearly there's a shift in actually getting signals from the body that go to the parts of the brain dedicated to those body parts, to parts of the brain, as I said, that are related more to the way we think about things. And so the idea for that category is that they become they maybe start as normal symptoms and they become neuroplastic symptoms, and the brain is it's misjudging, it's miscalculating benign signals from the body as pain signals, right? So it's false alarms, if you like. It's a thermostat that's gone crazy. The other collection of neuroplastic symptoms is more related to trauma from the past that's expressed in the body, and but again, I think this is the most important thing about this whole area of science and medicine, is that the brain generates the inflammation, or it generates the actual pain that's experienced. And it's very important to say here, it's real pain. It's not, people aren't malingering or exaggerating. They're experiencing often terrible pain, and they really do, and they take analgesics to dull it down. But of course, the analgesics aren't touching at all this misdiagnosis by the brain.
Yeah.
Right. So that's a preparatory, I think, information to answer your question. Can people did they have to go to therapy to fix this? Well, maybe not. There are books out there now written about this. I think a big part of this is psychoeducation. Mm-hmm. It's like, oh, hang on a second. So there are ways of self-diagnosing, if you like, whether my symptoms are neuroplastic. They have these sort of a sort of way of triaging, a series of questions. Things like, if say it's pain, does it move around the body?
Yeah, that was an interesting conversation. Yeah.
Yeah. Did the onset correlate to some traumatic episode or period in your life? There's a number of these questions that would help a person go, oh yeah, hang on a second, and just to know that pain and a lot of bodily symptoms are created in the brain. They're not a one-to-one correlation. That can help people sort of step back little bit. And then the therapeutic process is one of being able to talk back to one's brain, as it were, right? So this is very similar to a lot of psychotherapeutic processes, like self-compassion, for example, where you learn to retrain your brain with respect to its attitude to yourself, right? And so I think it's this process of, gradually over time. Now, probably it's going to, for the same reason that psychotherapy exists and I have a job, it's probably going to be more effective doing it with another person. Partly because, hopefully that other person has deeper knowledge, but also can carry you with their confidence. And I'm not talking placebo there. I'm just saying help you keep going long enough to do the necessary rewiring.
Yeah.
Right? So, but I guess the strict answer to your question is it's possible that a person can do it on their own. No question. It's just like probably going to be more effective and quicker and easier. It might be more expensive, of course. That could be a consideration. People are going to have to pay. It's a complicated question. And I think one of the things that might lean me towards suggesting people go to therapy is, especially if a person has negative self-image, is low self-esteem or is self-deprecating, left to their own devices, they might blame themselves for having this pain that doesn't have a physical cause, and then that'll feed into a self-script about being deficient or not good enough. So I think that's one potential problem there. Was there a reason behind your question?
No, I think it's more, and this is helpful, and sort of what I anticipated. But it's also, I was sort of thinking, like, if somebody's just sort of in a situation where they've got all of a sudden like a flare up in that pain in that moment, or is it as simple as saying, okay, this is like something that's happening in my brain, maybe this isn't real? Like, are there techniques to even help manage in that minute or in that moment when you're not able to go
Yes,
and engage? Yeah.
Yes, and there are, and I think that's part of the neuroplastic therapy regimen, is to expect that you're going to get these flare-ups, and then you examine, well, what just happened, and so you can more quickly go through the cycle of, oh yes, okay. The other thing is, as probably all of you know, if you're talking about, something like back pain, I always remember I was shocked, and I shared this with Dr. Clarke. I have a good friend who's a chiropractor, and I've had back problems for ages. I did have a pretty serious disc bulge, and it was a specific event. And I always remember the way that the physiotherapists and doctors talked to me about how I'm going to have this for life, and I'll never lift more than 20 kilograms, and like, it scared the shit out of me, and I was extremely careful about everything that I did, and I think the thinking has changed dramatically. This is a long time ago, whereas they want to keep people moving and actually testing the boundaries and so on. So I think that's the other part here, is that it may help people so they don't just lie down on ice and all that sort of stuff and drop their exercise and drop what they lift. You know what I mean? Like, it'll also help people go, okay, I need to be sensible, but I didn't get to ask him this, and I'd be interested in your views. I presume the brain not only creates pain signals, but it can also create actual inflammation in the body. The caveat there is I'm not a medical doctor, and I'm thinking it may be useful at times to take an anti-inflammatory or put ice on a symptomatic area, if indeed there is inflammation, right? Just like taking an aspirin, Yeah, but that's a very, very interesting question, Chris. What else, guys?
I can go. I just kind of continuing on from where Chris was at. Well, first of all, I'm going to listen to this one again because it was absolutely fascinating. And like, I was sad when it was over. I wanted more. But I just like so thankful for the awareness. And I'm hoping that this becomes more of a talking point. Not just
Yeah,
awareness on the clinician type, the clinical aspect, but as far as people having more awareness of like, I'm not getting the answers I need from my doctor. What's going on here? And thinking about this neuroplastic symptom as a different route to go down without being diagnosed by a doctor. Um, so not really a question, just I feel like there's just more and more awareness, kind of mimicking or in line with Dr. Gabor Mate and like the whole mind body system of it being one thing and just moving away from the stigma of the woohoo into like this is science and researched backed
yeah,
facts, and just people having the awareness. I think it's a very exciting thing to continue to watch.
yeah, yeah. A few jumping off points from that. Thank you, Karen. One is Dr. Clarke quite rightly. He said well, the first thing you should do is go to see the relevant medical specialist to make sure, in fact, and do all the thorough testing to make sure there's not some breakage or some serious identifiable pathology. So it's not about throwing out traditional medicine. Quite the contrary. It's to work with and alongside that. So I think that's a really important thing to say here. And like you say, it's not woo-woo. It's actually coming out of, his fascinating story, for example, when I asked him about, well, how did you come to this? And he talked about that pivotal client.
Yeah.
And, it was just abdominal pain with they tried everything. And it wasn't just him who tried everything. And he eventually sent the person to a psychiatrist, and then he happened to bump into the psychiatrist in the lift. He said it was the lift ride that changed his life, because she cured him after a couple of months, a month or two, I think, of treatment. And so, and she taught him, I think, what turned out to be the fundamentals of this therapy.
Could you imagine the relief for that patient after years and years of
Yeah.
going through all these things and
Yeah.
like the multiple treatments? Like just it's fascinating.
Yeah, and there was the early on the first real turning point was the Boulder City study on back pain. So basically, they had a large cohort of people who had had serious chronic back pain for minimum 10 years. It was treatment resistant, and they had like a really good randomized clinical trial. They had three groups. So you had one group, and they were randomly allocated, who was just had their continuing treatment. You had another group who had, I think it was cortisone injections into the spine, and the third group had neuroplastic symptom therapy. And the results were just astonishing, right? 75% of the there was small improvement in the other two groups, but pretty small, statistically significant, but in real world terms, small. But in this group, 75% reported some pain all the way to no pain. So 66% said no pain or very negligible pain, and 75% said very significant reduction in pain. And like that is unheard of in this space of chronic back pain. And I didn't finish my story, did I, about my chiropractor friend? He was telling me about MRIs, and this relates to this, because he used to treat me for my poor back. And after a while, there was less and less improvement from treatment. And I said, do you think I should get an MRI? And he says, not really. And he's trained in reading MRIs. He's very skilled. And I said, why? He said, because the studies are showing that there's no correlation between what we see on the MRIs of backs and the patient's pain. So we'll find people with really terrible looking backs and they're symptom free. And we'll find people with perfectly looking backs and they're in terrible pain. And so there's virtually no correlation there. I mean, that would not include things that are damn obvious, when you can see a tumour, on the spine or something like that. But when you wash it out, so things like the Boulder study, what they've now seen about this failure to correlate, this is very powerful evidence. And that Boulder study was one of the first, and I'm not. Dr. Clarke said there's plenty more, and I believe that is the case. So it's a fantastic companion to traditional treatment where people were feeling completely hopeless, and it gives them this. The other thing I like about it is it puts their cure in their own hands.
Mm-hmm.
Right, so this is a massive shift, and this is what I really appreciated. I ended up ignoring the advice that I shouldn't pick up 20 kilos. Like, I was a young man, I thought, bugger that, I'm going to live a life. Do you know what I mean? And sure, I'd have episodes every so often, but I thought I'd rather have a life than be protecting this injury. And this giving people a sense of agency, a sense that of not being helpless. Mm-hmm. I think it's a huge part of this. Yeah. What else?
So I came at it a little bit differently because I've been fascinated with neuroplasticity.
Gee, that's surprising, Terry. That's so surprising.
Actually, quite a long time, because I was taught in university that the brain, you can't change it. You get what you get, and like that was it, and that was the thinking then. So when I picked up a book, because I was really curious about it, the brain, and started reading it, and they're talking about people, even able to completely change parts of the brain. If, like, you could have an eye injury that's supposed to be here, and that's damaged, so your eye's damaged, but with proper training, you could actually have a different part of the brain then take over the eye. So,
yes.
So that was the beginning of my exploration, and then the whole mind-body thing came next. But what got me about this thing was that stat at the end about,
the scale of this.
Yeah, 48% of the population approximately is either getting treatment that's doing nothing, or they can't find a treatment for it, so they're floating out there, feeling hopeless. Mm-hmm. And I started to think about that in context with, with AI's ability to sort of connect an awful lot of dots. And I actually think the only application of AI from what I can see that has really positive human, making the world a better place versus killing it, sits in the sort of medical realm. So I was just thinking, like, there's so many people, especially my, generation, that still don't know what this is, and we're taught coming through the education system that you can't change your brain. So they just got that mindset.
Yeah.
And that's the opportunity. How can you get to them to say, actually, no, everything we knew back then is wrong, just like it is for so many things.
Mm-hmm.
There actually is the possibility that that we could get rid of this pain.
Okay, so thank you, Terry. So maybe for the listeners, a little, again, preparatory thing about neuroplasticity, which is what you're describing. So you're right. There was, for quite a long period, the accepted wisdom was that largely the brain was unchangeable after certain developmental periods in life. That's still true. Like there are periods for children where they can just pick up languages very quickly. There are critical periods for a number of developmental things like social coordination and so on. So kids that, there are unfortunately terrible documented cases where kids have been basically imprisoned by their parents.
Or like what the Jesuits used to like do to turn them into, people running around the world pushing the faith, right? Is they would
Yeah.
get kids young
Yeah.
when their brains could be molded and shaped.
Exactly.
Because it wouldn't happen later.
But that idea of critical periods being the only space for neuroplasticity has been debunked. Now, we don't want to swing the other way. It's not like you can just change everything, and in fact, you wouldn't want to. But there's a lot more room to move than we ever thought, and the psychotherapeutic experience is really, in the end, it's about brain change. It's like changing your mind about something. Learning anything new is an example of neuroplasticity. Developing any kind of motor skill is an example of So it's that's of course a revolution in psychology and in neuroscience and so on, psychiatry. And a very welcome one. And so this fits very neatly with that. And I think you're right. A lot of people think that things are kind of set. The other thing, though, Terry, is I think that a lot of people think, well, the body's there and the mind is a completely separate thing. So this is a natural error, if I can put it that way, that because we philosophically, people may not have studied any philosophy, of course, hold a dualist view, that there is this mind which is non-material, and then there's matter, and then there's this mystery about how they interact, and of course this breaks that down into the fact that they're just the two sides of one coin. The consciousness and mind is still mysterious in many ways, but it's clearly an emergence of matter. So there are going to be people out there who disagree with me, and they say it's spiritual essence and it doesn't die, and that's fine. But I think at the very least we can say that there is this very, very intimate relationship between our physicality and our mentality, and if you change one or the other, they affect each other. Because you can work on the body, right? You can exercise, you can eat good food, you can have massages, and it changes your mood and it changes the nature of your thinking, right? And so I think this is grabbing onto this helping people understand that nexus. But to get to your point about the sheer scale of this, I mean, it is extraordinary. I was thinking about the opioid crisis, for example, and which is, I think, is an excellent example of what they're getting at here, is that as people take more and more opioids to deal with, sometimes it's psychological pain, sometimes it's actual physical pain, and they become less and less tolerant to any sensation. So their brain begins again to set off more and more false alarms about damage that's not there. Right, so what you and I might consider normal sensations, the brain interprets as a danger signal and therefore gives the person pain, so they need more opioids, which further dampens down the body's top. It's on high alert for pain signals, and then of course it finds them, and it's a terrible vicious cycle. Right, and I think I read somewhere the other day in the US, at least, there are more opioid deaths than from smoking, for example, and I think it was one of those compilation statistics like smoking and car accidents and something else, but so it's a massive issue, and that's one, I don't know what percentage of that, like 25% or 48% that's going to be, but it's going to be a significant portion of it. But you're right, it's like this is like massive in terms of the numbers of people, the cost to the economy, but of course the costs, the personal costs in suffering that may not be necessary. Yes, I think the relief, like as Karen was saying, the relief that people must experience when they can be liberated. I think he said his oldest client was a guy in his 90s. He'd had this pain for most of his adult life. Can you imagine that? It's such a wonderful story, you know. And as we said, then this is not hocus pocus. You know, that 5-year follow-up on the Boulder study, that blew my mind. That 66% had held after 5 years with no further treatment. I mean, if you want evidence, I know that one's confined to back pain, but that's going to be relevant to a lot of people. Like, that is extraordinary, and it's true.
You have to wonder, as there's more and more evidence that comes available, that insurance companies will start to cover mental health or psychotherapy.
Yeah, I think so.
Yeah.
Yeah, and again, it's very, very important to distinguish people who are suffering neuroplastic pain, for example, or illness. They're not malingering. No one in their right mind, I shouldn't put it that way, should I? I'm not saying they're crazy either, but no one in their right mind would deliberately create this level of pain and suffering. No one, right? So it's not that. It's psychoeducation, and then giving this practice of this rewiring. And it takes time, of course. It's not like an instant cure. It's any kind of neuroplastic rewiring that's intentional is a practice over time. And maybe that comes back to Chris's point. As in psychotherapy, generally, people have relapses, and that's to be expected. These patterns are very deeply etched into the neural architecture, and every so often they're going to be triggered by the appropriate stimulus, some context, some event. Like, it's not like you can scrub them out of the architecture. What you're actually doing is you're creating a viable alternative to it that eventually becomes easier to fire off than the original pattern. Mm-hmm. Yeah. This leaves, of course, the wonderful Colleen. What's happening in your fertile mind?
Well, there were a couple of things. I mean, I think there's, like Karen mentioned, there are going to be the people who find relief from this, but I think
Yes.
there are also going to be the people that, and maybe it's generational or maybe it's not, but just aren't ready to accept that it's,
yeah, that's true.
you know, they have to put the work in, and they have to accept that it may actually be in their head, you know, and I mean that in a good way. Like it's just gonna take a little bit of work in a wonderful way, but they can't get past those physical symptoms, those physical impairments.
That's a wonderful point. I'm sure that's true, and sad and somewhat tragic at the same time.
Well, there's still
very often
stigma attached to any sort of mental health therapy. And just like you said, Karen, you know, insurance doesn't even cover some of it, but there's...
Yeah. And this the whole idea of psychosomatic, right? So, you know, it made me think about like what it's like to be a therapist, right? And you get, especially over 30 plus years, you get all sorts of people, all sorts of issues, ranging in intensity, you know, and so on. But it's very, very, very common that you either can't help people much or very little. And it's nothing about, maybe sometimes it is, but generally speaking, it's not about the therapist's skill set or empathy or connection. It's the readiness of the client. And it's an exact corollary to what you're saying. It's like, are they willing to take responsibility and accountability? Are they willing to look inside? Are they willing to drop some certain things? And it's like sometimes it's like watching a slow motion train wreck. It's like, oh, please don't do that. Don't continue. You don't have to do that. But you can't give someone that insight. You can't, you can tell them, but it won't make any difference, right? So I think you're absolutely right. There will be some sort of statistical curve on people who take. Well, if you take the Boulder study, it wasn't 100%, right? So there's going to be at least 25% who probably didn't get any benefit, right? And they may well have fitted into some sort of psychological profile that would predict a less likely positive outcome, right? And, in my game, there's a saying, I think I've said this to you guys before, but, as a therapist, you don't want to be the most motivated person in the room, right? It's like, if the person's not taking full ownership, if they're not really, really engaged, they're not going to change. And there is a subcategory of people come to therapeutic encounter who want to, this is how I put it anyway, who want to change without changing. And
and on the flip side, I think medical professionals, I think what Dr. Clarke is doing is really important. I mean, I have a father who's a gastroenterologist and a sister who's a gastroenterologist, and one would probably say it's just in your head, and the other would say, actually, there is all kinds of data that says, it trauma and this and that. So it should be mandatory that medical professionals have this information.
I think so. It's a bit like, and again, I'm pushing a little bit outside my, my own brief here, but, my expertise. It's a bit like MDs, well, it used to be the case. They had very little training around nutrition, right? And I think that's being corrected now, but still, it's like, hey, I mean, this is really fundamental. What you put in your body every day is going to impact on your physical health. So I think that this might be a parallel sort of thing for medical doctors and specialists of different kinds to recognise that this huge category. I mean, we've all heard the stories. I was just listening to a friend down the road had a back operation, and the doctor said it would take a couple of months to heal, and 6 months later she's in terrible pain. She's walking stooped, and she goes back to see the doctor. She says, you're a bit older, just give it another couple of months. And I feel like I can't really say anything. But she's in terrible pain, and I can just see the way it's diminishing her in her life. It's just shrinking down, and then you can see that's going to then correlate, hopefully not with her, but with feeling depressed, and which is fair enough. So I think there's huge upside and potential here for that. Incorporation of this is just part of the toolkit, part of the understanding, so that and then you get the sniff. You ask 5 or 6 questions, and and you go, oh, I wonder if this is neuroplastic. And then you ask a few questions. When did it occur? Was it paired with this? Was it, what's the nature of it? Does it, And if it does, you can then educate people about this other dimension, or refer on to someone who specialises in it. Yeah. All right, my friends. I really enjoyed. I think he's a lovely man, and he's clearly onto something. He's very dedicated, and I think he's doing something great in the world. I had the sense, I'd never discussed this with him, but he'll be doing this to the day he drops. Did you have that sense? You know, like, yeah, wonderful thing. It's a real vocation, but he's not deluded. You know, he's crystal clear. Nice sense of humour, you know. So I hope I have more conversations with him, actually. I really enjoyed just being in his presence.
I think people need to hear him.
Yeah. So they can on that podcast I mentioned at the beginning, and of course going to the website's interesting too, symptomatic.me. Lots of case studies there, and a link to the podcast, and he's got colleagues, and I've heard some of them talk as well. And like I said, there are books out there. But the one I read was called The Way Out, I think. Author escapes me at the moment, but it's not hard to find the books now. So, all right, excellent. I was really looking forward to this roundtable. I'd be lying if I said that you've disappointed me, because you haven't, of course. And we'll talk again soon. Take care.
Bye.